I always dreamt of putting a practice together that was almost a one-stop shop for patients. Patients can come here now for total wellness, from taking care of their gynecologic problems to taking care of their cosmetic issues. We're a one-stop shop for people today. I delivered babies for 17 years and I hit 7,500 babies 3 years ago and decided it was time to kind of hang up that part of my practice. And at the same time, we had a growing cosmetic practice. At that same era of my practicing, we had contracted out and did Medi weight loss. And it kind of just grew together to the point that it was easier for me to go to one place, to be there so that I can see the patients. I have my presence here now, and it's been a dream come true. When I was a little kid, I have 3 brothers. Didn't know anything about this whole women's world, and I heard my mother always talking about her OB that delivered all of us. He was there for all the babies. When I decided to go into this field, I wanted to be like Dr. Miller, because that's all I heard was Dr. Miller this, Dr. Miller that. And I committed myself to it. I started my practice 20 years ago, going on 21 years. 7,500 babies later, we're still here, basically one of the last private practices to start in the greater Kansas City area.
I had just experienced my 4th miscarriage and had been working with an infertility specialist for a couple of years to have a successful pregnancy. So finally I had a friend that was a patient of Dr. Mirabile's and had a meeting with him, and he took me on as a patient, and I was just very, very grateful to be working with someone that would let me try to have another child. We're both here and she's perfectly healthy, and so I think he knew the risk, but I think he believed it was worth a try, as long as I knew going in that, you know, it could very easily not work out. There's no reason I should have a second child, and I have her really only because of Dr. Mirabile. Total wellness is a concept, I think, that starts very early. It's educating our younger people about the risk involved with different lifestyles that we may entertain. We're seeing a tremendous amount of disease. Cancer of the breast is so prevalent. Half my family may not be here had we not been in practice with Dr. Mirabile. We found a bump in my chest during our annual exam and got right in. When they found the lump, they got me in immediately for a mammogram, got me in immediately for a surgical biopsy. Had 7 surgeries that year. They stood by me every step of the way. I got several calls from Dr. Mirabile personally in a period of days. Checking on me and waiting for MRI and CT results and things like that. I don't know exactly how you say thank you for giving me a daughter or saving my life. So he's just amazing. I have the utmost gratitude and respect for him as a physician. About 15 years ago, a friend of mine approached me, and he was just doing gynecology, and he came up with this idea of bringing in cosmetics into a GYN practice. The atmosphere is there, the patients are there. It would be a place that the patients are already looking at us for their medical treatments. Why aren't we providing these type of services? They're non-invasive, it doesn't require surgery. It's a perfect marriage for us. Our audience is there that we're already taking care of for the medical needs.
Our treatments consist of dermal fillers, Botox, which are both cosmetic injections. They help smooth wrinkles. As our skin ages and we lose collagen, the dermal fillers are used to restore that volume and smooth out the folds and lines that form over time.
I'm getting lines on my forehead and a furrowed brow, and it looked like I was questioning everything everybody said. I had a constant look of disbelief on my face. And she was able to look at that and kind of tell me what she saw. We do a consultation with folks prior to doing treatment. We have intake forms and things so we learn a little bit about them. All of our providers, our nurses and our estheticians, are all very good at consulting. They take a very consultative approach. We don't expect a client to call us and say, this is the exact treatment I need. We expect a client to call and say, here's what I'm faced with, here's what I'm up against. And then from there, the provider can evaluate that person and determine what's going to work best for them. The thing of it is, you come in and talk to the staff. It may just be some skincare that you need. It may just be a change in your diet. It could be little things. I really feel confident that they would not suggest a treatment if you didn't need one. You know, if there's other solutions, they would offer those solutions. But when it's time to have a treatment, then, you know, you can put your faith in them.
Well, I really wasn't that well educated, and that's where they came in and kind of talked to me about my options and what would work best for my skin.
One of the things that impressed me was about 10 days after the treatment, the technician called and wanted to just check up, make sure everything was great and that I was happy with the service, and wanted to find out if I had any more questions. So I like that follow-up. That was really helpful.
We have many laser treatments available that can treat just about any skin condition. Laser hair removal, of course, which is a really popular treatment that's been around for quite some time. We also have body contouring, so we use our VelaShape 2 to treat cellulite and to reduce the circumference of skin, so to lose inches, and then also just overall surfacing. A lot of times folks will have acne scarring or other imperfections in their skin, and the lasers are great at just treating that overall surface area.
I had Botox, and I had Juvederm, and a hydrofacial. Having a professional doctor on site is really key in why I selected Mirabile to do any procedures with, because you feel just more safe in that environment.
That's something we're really proud of. A lot of med spas in the area do not have their physicians on site. Dr. Mirabile is our owner. He's invested in the day-to-day operations of the clinic. Any new treatment or product that we bring in is thoroughly reviewed by him and approved by him before we start offering it to our patients. Our nurses primarily do our injectables, so Botox, Dysport, and those dermal fillers. They also do several of our laser treatments. What they pride themselves on and what they have become known for is giving very natural looking results. Our goal is not to send someone out here that looks like they've just had filler. Our goal is to send somebody out the door who just looks a little more youthful, a little more refreshed, and who smoothed out those lines or those wrinkles.
We're in a generation where men care about their looks and are taking care of themselves, and if you look at just job opportunities, an appearance for a job, and you compare someone who really doesn't have the best, presentation, it is so important today to have that. And we take care of a lot of gentlemen before a job interview. They want to, tidy up, or they want to do something for themselves to look better and feel better about themselves, because beauty does come from within. If you feel good about yourself, you're going to present yourself out.
I work with 20-year-olds. I mean, my whole staff are in their 20s, and I always feel like the old man. So one day I was kind of looking in the mirror and I just thought, there's stuff that can be done about this. So I thought I'd check it out, and I'm really glad I did. Being a guy walking into a med spa, I was a little nervous because I thought it might be kind of a girly place. But I was really surprised when I walked in that it was very gender neutral, and I felt comfortable immediately. I think it's one of those things that if there's something that bothers you and you've been thinking about it, just get a consult, get it checked out. It may not be something you want to do, but then again, it might be, and it's no big deal.
With the practice of med cosmetic entering the second decade, I was approached by one of our medical drug reps with the concept of developing our own skincare product.
Well, we have a couple of different lines here. Our primary line, though, is the Mirabile MD line, and this was created by Dr. Mirabile. It's our own specially formulated product line. This is not something that would be the equivalent of what you could get at a drugstore. It's medical grade, which means it can only be sold in an office where a physician is working.
We cover every facet for treatment, from moisturizers to eye creams to facial washes, facial scrubs, anything to nourish the skin, highlight the skin, and it's both for males and females. A
lot of times, folks assume when they come into a med spa or any kind of spa that they're going to be sold something that's marked up 300–400%, and that's not the case with our products. Our products are very equivalent in price to what you might spend at a drugstore, but the quality is so much better.
We feel it's a very superior product. So many products that we buy, over the counter or not physician graded products, they are not able to have the same ingredients or the amounts of ingredients, and we found the right combination and are so pleased with the skincare line, and our patients are too.
I have clients come in and they'll say things like, "Wow, you look great. You look better than I've ever seen you before," or "You look really well rested." And I love that because they don't know what I had done, and they can't put their finger on it. They just know I look a little different, and that feels good.
We kind of pride ourselves on doing things in a non-aggressive way. We try to keep our results very natural. The perfect compliment that we can get is people just asking what I've done. I look so well rested. I, look like I have gotten lots of sleep.
There's days when you look in the mirror and you think, oh, I wish I could look a little bit better today. But now I really do. When I look in the mirror, when I get up, I feel better about myself.
Medi Weight Loss is a phenomenal program for people. We looked into this, we looked at other programs, and we found that a physician supervised or monitored program with a great team of individuals that we have here is the real key element to bringing wellness to people. 70% of our nation is labeled obese. The problems associated with elevated blood pressures, diabetes, our health care is going to be complicated by all of this. We're the generation that's going to feel this. And with the rising cost of health care, we need to learn how to take care of ourselves and be healthy. And that was the real desire behind bringing Medi Weight Loss Clinic here.
I've been one of those guys that has been overweight pretty much his whole life. 6th grade on is when, I really noticed that, the kids were calling me fat, all that kind of stuff. I would try to do things about it, wouldn't really work. As I went on in life, I got married and I ended up getting a divorce, and as I was reeling from that, I ended up getting worse and worse and worse, and at my absolute worst, I was 475 pounds. The whole reason I made this decision was because I had been getting my life back on track and back on my feet after the divorce, and then I just realized that, I was still unhappy and I didn't know why. So I sat down and I made this list, just of all the things that I thought were making me unhappy. And then as I went over that list, I realized that, it was like a 28-item list. 27 of those items all went back to the fact that I was overweight. I don't know what happened, but something snapped. Something finally snapped. And, I started looking on the internet, started looking around. I actually visited a couple of places. This was the first place I actually felt comfortable in.
We have seen so many life changes. We get so connected to these patients that we're celebrating with them. Sometimes we're crying with them. I mean, they really truly have improved people's lives from decrease in maybe their blood pressure medication. And we've had other patients that have cut their insulin dosages, by 2/3. And then we've also had, patients that have started dating again, or maybe they're coming off of a divorce and they want to improve, their self-esteem and improve their health. And it's really empowering for us as well.
I really think the whole key is the one-on-one accountability that the staff has with each patient that walks through the doors.
I definitely did my research, and then I called, made the appointment. They got me in for a consultation where we sat with them and learned everything, and then from there on you start weighing in every week with the counselors, and it's pretty awesome. They are my family. They've met my family, they know me by name. They're like a sponsor. They email you back and forth, you can call them anytime you want. It's family.
Each and every week, these people are on my side. I mean, I get cheered every time I come in the door. I get told that every time I weigh in, everyone is checking the website to see how much I've lost. I mean, it's really a great feeling when you sit there and realize how much these people actually care. They care week to week. They, they want to know about my personal life even. I mean, as I've lost all this weight, I've started going on some dates, and they've wanted to know what that's been like. And for my birthday, Marcia made me some pumpkin pie that was low carb. I was just because I love pumpkin pie, and I know I would not be able to eat that through Thanksgiving this year, but she brought it in and it was great. I mean, she didn't have to do that. That was awesome. It's stuff like that, and the fact that every time I come in here, it doesn't really matter what mood I'm in, I leave with a giant smile on my face. These people here make me feel like I'm a decent human being. It makes me feel like I'm not, a drain on society or anything like that. It makes me feel I don't feel fat anymore.
The clinic as a whole, as of now, we've lost over almost 17,000 pounds. It's a lot of weight to go around, and our patients are happy. I would walk in here every day and I'd see happy people. I'd see patients, they were either laughing, they were crying, the girls do such a wonderful job. They bring them into their family, and patients do well with that. They're monitored closely for any medical issues. We do use a prescription weight loss medication.
Our patients will receive a multivitamin. They also get a fat burner supplement, and then they have a calcium, vitamin D, and magnesium supplement as well. All of those three supplements are really meant to replace the nutrients that are lacking while they're on a restricted diet.
I feel better. I have more options at the clothing stores. I have a natural energy that's inside, and it just made me comfortable in my own skin. I was always happy on the inside. It was just what I felt like on the outside.
The fact that I've lost all the weight has given me, or lost the weight that I have lost, has given me a lot more self-confidence than I used to have. I mean, my self-esteem, as my weight went up, my self-esteem went down. So it's kind of doing the opposite now. So I wonder what's going to happen when it gets to this point, because I'm going to be borderline arrogant at that point, I think, just for the sheer fact of how I feel. But getting that self-confidence back has helped me, you know, put myself out there, go out on some dates, you know, get my extroverted nature back that I used to have 15 years ago.
I'm active. We do things at the family, and I've got a little guy, so we're always at the park or we're doing something fun and active, and I can keep up. And as far as confidence level, it's way greater. So it's a success. It really works.
A mixture of their products, the tools that they gave me, all of that has just made this perfect storm of awesome that I've become. So I absolutely love it.
This is exactly the dream I had 20 years ago when I went into private practice, was to bring together a wellness concept. I have a wonderful staff that's with me today. I couldn't ask for better people to associate myself with or to spend my days with. And I think we have a great concept bringing in both weight loss and cosmetics into a medical practice. And we've created a great atmosphere for that. I've had 20 wonderful years, and there's nothing more gratifying than walking into a room with a patient that I delivered, and they bring in a young girl with them and said, "This is your baby you delivered." And you know, the kids I delivered in this area are now 20 years old, and they're coming in for, you know, the same services that their mother was back then. I just want everybody to feel welcome in the practice. I want a home atmosphere. I want to be treated a certain way in life, and I want my patients to expect that same treatment. And I think we have a wonderful staff to provide that atmosphere, and it really works.